Hello everyone, and welcome to the online recording for the UCI GSHIP Town Hall. The purpose of this recording is to give you an idea of the changes that will be occurring for the UCI Graduate and Professional Students with regards to health insurance in this upcoming year. The information presented in this recording is basically similar to that was presented in the actual physical town halls. It's just for online consumption. Okay, so I'm going to begin just by talking about what GSHIP currently is. For those of you who aren't fully aware, it's a mandatory health insurance plan for all graduate and professional students here at UCI. By mandatory, we mean that all students are required to either be a member of GSHIP or to show that they have equivalent insurance and waive out. The Student Health Center is used as the primary care provider, which means that if you get sick, you need to go to the Student Health Center first, and if they can't help you, they'll refer you out. The only exceptions to this are in the case of emergency, in which case you should call 911, or if you are out of town, in which case urgent care is permitted at other providers without a referral. The current health insurance for UCI graduate and professional students is provided by United Healthcare for medical, Western Dental for dental, and the Orange County Optometric Group for vision, which is the group that runs the UCI Eye Clinic. So as you know, GSHIP is joining UCSHIP this coming year, and UCSHIP is the system-wide health insurance plan for the University of California. It covers both graduate and undergraduate students, and the idea of this plan was that a larger pool of students would enable the UC to save money on its health insurance, as well as improving quality of care for all of its students. One interesting aspect is that this UC SHIP plan is self-funded, which means that the ultimate financial responsibility for paying out claims lies with the university itself. The reason for this is that this means that any leftover money at the end of the year that would traditionally be profit for the insurance company instead gets to stay with the health insurance plan and allows us to reduce costs in the future. So UC SHIP is entering its second year in this fall. This previous year it was just available for 6 graduate student campuses. This coming year it's going to be all 11 campuses, both graduate and undergraduate. We chose not to join the past year because the implementation timeline was rather tight and it wasn't clear what the benefits of the plan would be. But this year we are convinced that it's really going to be a win for all the graduate students here on campus, and so we've decided to go with the change. The coverage in this new plan is provided by Anthem Blue Cross for medical, Delta Dental for dental, and Anthem Blue View Vision for vision. I'm now going to talk about each one of these in a little bit more detail to give you an idea of how your coverage is going to change. First off, for your medical coverage, the Student Health Center is going to remain the primary care provider. This means that you have to go to the Student Health Center first in all cases except emergencies, or if you're out of town for urgent care, and that the referrals are required for any external specialist care. One change from the current plan is that for mental health care, you are going to be required to get a referral from the Student Health Center, whereas previously you could self-refer. So this is something to keep in mind. If you are currently seeing an external specialist or a mental health care provider, if you have had a referral previously, you shouldn't need to do very much to keep that going. But if you were doing it without a referral, you will need to contact the insurance billing office at the Student Health Center. One nice aspect of our new plan is going to be reciprocity with the other UC campuses. So if you are up in the Berkeley area or down in San Diego, you can go to their student health centers, whereas previously this was not really an option. Of course, because we're switching insurance providers, the new plan is going to be on the Anthem Blue Cross PPO network. So this is different than the Student Resources United Healthcare network, so it's going to be required for you to verify the network coverage of any current specialists you're seeing. To do this, please just call up your specialist and ask them if they are a member of the Anthem Blue Cross PPO network. Don't ask them if they accept Anthem insurance, ask them if they're a member of the network, because a lot of people accept insurance but then will just charge you higher rates. If for any reason your specialist is not in the network, please contact the Student Health Center, let them know, and we will do our best to make sure that that provider is in the network so that you can continue seeing them at low cost to you. An analysis has been done of the most referred to providers by the Student Health Center, and we believe that there should be very few students impacted by this shift in insurance. Another nice benefit is there's going to be a 24-hour nurse line available, so if you have any issue, you can always call it 24 hours a day, 7 days a week, and they'll be able to tell you if you need to go to the emergency room or if there's nothing to worry about, that sort of thing. A little bit more detail on the specific schedule of benefits. On the center column we have the new plan with Anthem, and on the right we have the old plan with Student With United Healthcare, you can see the prescription drug copays are going down by either $5 or $10 depending on the tier, so you'll pay a bit less money there. Also, the coinsurance rate, which is how much you pay out of pocket for some procedures, is dropping from 20% to 10%, so you'll pay half as much out of pocket for those. One very nice benefit is that preventative care, which was previously either $15 copay or not even covered if you were a man and wanted a yearly checkup, for example, is switching to no copay, and both men and women can get their annual checkups that are encouraged, so that's really nice. Specialist care is also going down by a $5 copay. Mental health care, the structure is a little bit different. You're going to pay, instead of 20% coinsurance, you're going to pay a $15 copay, so this could either save or cost you money depending how much your provider costs. One slight negative is laboratory services. It's switching from no copay to 10% coinsurance, so most laboratory tests are relatively cheap, so this would only mean a few dollars out of pocket, but for more expensive tests, this will unfortunately incur greater out-of-pocket fees. So if this ends up being a big problem for you, that you're spending a lot more money than you were previously, please let us know with the committee, or contact the student health center and tell them you're unhappy with this, and it'll get back to us and we'll see about reevaluating the plan for next year. Lastly, the annual deductible, switching from $200 in-network, $500 out-of-network to a $200 combined deductible. So if for whatever reason you're seeing out-of-network providers, this can save you a good deal of money as well. It should just be noted that all the numbers quoted in this benefit comparison were for in-network care. The full details of the schedule of benefits for the last year's plan can be found on the website listed below. This is the plan that was used by the 6 campuses on UCI GSHIP this current year. The next year's website is in the process of being updated and should be up soon. The main difference is that the address is going to change. Instead of being /UCI GSHIP, it'll be /UCI SHIP. So I encourage you to check back when that comes, but there shouldn't be many substantive changes between last year's and the next year, so the information up there will apply. Okay, now for the dental. We are going to be switching from Western Dental, which is a local HMO provider, to Delta Dental, which is a very large national dental PPO. So this is going to be very exciting because instead of just being able to see the few providers in our area, you'll be able to see the vast majority of dentists in California and basically across the country. You should of course verify that the dentist you want to go to is in the Delta Dental network, which should be done by asking if they are part of the Delta Dental PPO network, rather than asking if they accept the insurance. The benefits are slightly different because because of the difference between HMO and a PPO plan. With a traditional HMO, you pay very little for certain sets of procedures, but other procedures are entirely out of pocket. So for example, if you wanted a most basic type of filling, it would be very cheap, but if you wanted like the more advanced fillings, you had to just pay it all yourself. The PPO plan, instead, you get to pick with the help of your dentist exactly what it is you want, and the insurance company will pay their percentage, 20% for things like fillings. Well, 20% you'll have to pay out of pocket for things like fillings, 50% out of pocket for things like crowns, and there's no cost preventative care, so you can get your cleanings as usual for no out-of-pocket cost. The only downside to this is that there is a $1,000 annual maximum, so if your dental care exceeds that in a given year, you will not be covered past that. This may seem a little bit low, but it's pretty much on par with dental plans across the country. The faculty at UCI are also on Delta Dental, and they receive a $1,500 annual maximum. Lastly, you can go to the website down below to find out the full benefits and more information. Also, it's likely going to be switching from /UCI GSHIP to UCI SHIP at some point. Lastly, for vision coverage, because vision coverage is not going to be provided by the UCI Eye Clinic, it's going to be leaving the Student Health Center. Luckily, they're just moving nearby to the University Center, so if you really enjoy going to them, you can still do that. And they're also in the process of joining the Anthem Blueview Vision Network, so your insurance will work there as well. So Anthem Blueview Vision is a national network. For example, there's 3 providers less than a mile from here, but you can go really wherever you want that's in network, including if you're back somewhere else in the country. It's also nice, this type of insurance covers places like LensCrafters, so you can get your glasses there. The annual exam fee is pretty similar. One major difference is that instead of just offering a discount plan like previously on glasses and contacts, you instead of partial coverage, which means that up to $120 of your glasses and contacts fees a year will be covered by the insurance. So that can save you a lot of money. And the website for this is the same as the one for the medical care, and it's listed down below. Lastly, I want to talk about dependents and the dependent plan. There is going to continue to be a voluntary enrollment dependent coverage for all spouses and domestic partners and children of UCI students. It should be noted, as with the current plan, you may not use the Student Health Center. It's an insurance plan that is not through, does not use the gatekeeping functionality, so do not go there. For your partner, the rates are pretty similar. These are showing the annual rates, though of course you pay by quarter. For children, there's a pretty big difference. Instead of paying $2,000 per child, the new plan is going to be $2,800 for all of your children, no matter how many you have. So this will save you money if you have more than one child, but cost you if you have only one child. The benefit structure is actually quite different for this new dependent plan. Your coinsurance rate, instead of being 10%, is going to be 20%. However, instead of having no out-of-pocket maximum, you're going to have a $6,000 out-of-pocket maximum, which means that if you spend more than $6,000 a year, the insurance company will cover the rest up until your plan maximum, whereas previously, if you spent that much, you just have to continue paying out of pocket. So this can be a good benefit if you unfortunately do get quite sick. Lastly, the prescription drug copay is switching structures a bit. Instead of being $15 for all drugs, it's going to be $5 generic and $30 non-generic. But your prescription drug maximum is going up, and this is the maximum amount that the insurance company would pay towards the drugs a year. So if you were on a recurring prescription that was rather expensive to the insurance company, instead of being cut off at $750, you have up until $5,000. So that's a nice benefit if you're on regular drugs. So that's where I'm going to end. If you have any further questions, those were the two websites I talked about earlier. And as I said, they're likely changing from UC GSHIP to UC SHIP. We will, of course, send out more information as it becomes available to us and everything gets closer to the implementation date, which I should say is going to be September 22nd for most students. And that's when your insurance is going to shift over. And lastly, if you have any further questions, please feel free to contact me, Joel Osher, at the email I provided. Thank you very much for listening.